Working with the health authorities to improve screening and appropriate treatment of patients with hepatitis C, so to align with the WHO's overarching goal of eliminating hepatitis C by 2030. Again, we're partnering with other stakeholders to move ahead and be aligned with the WHO recommendations. Again, it's a lofty goal to eliminate viral hepatitis by 2030, but that's what we're trying to. That's the WHO's focus worldwide. Again, we'll be happy to take your questions as we go through. But as I mentioned earlier, especially with Ramadan coming up very soon, it's important that you take good care of your liver. And it's worth talking through those points again. Stay adequately hydrated, be active, eat a healthy diet, maintain ideal body weight or BMI, minimize or avoid alcohol consumption, and again, moderate amount of coffee use may be beneficial, but stay tuned to that space, more to follow there. Again, in terms of the health benefits from a liver standpoint, to moderate coffee consumption. We'll be happy to take your questions. Again, at the Cleveland Clinic Abu Dhabi, we have professionals trained and experienced in all these areas. And to take care of a patient with liver disease, we need a well-trained multidisciplinary unit. And that includes hepatologists like myself, hepatobiliary and transplant surgeons, diagnostic and interventional radiologists, liver pathologists, anesthesiologists, ICU or critical care physicians. So we work together so that we can better care for these patients, optimize their care, improve their outcomes and quality of life.
So there's a question.
Yes. Yeah, go ahead.
So how do I find a diet for myself, like a recommended diet?
Well, there are no specific diets that are recommended from a liver standpoint, but generally what we recommend is minimize saturated fat, minimize consumption of processed food, eat a wholesome, healthy diet, and as I mentioned earlier, minimize or avoid alcohol consumption. But again, it also is worth noting in that regard that exercising and staying healthy is important, and staying active is important, because many studies have shown that the health benefits of exercising from a liver standpoint is not linked only to weight loss. So exercising helps your liver independent of weight loss. And as I was mentioning a short while ago, fatty liver disease, we don't look at fatty liver disease as a liver disease per se. It's part of the metabolic syndrome, which has multiple components, as some of you know, with elevated lipid levels, triglycerides, low HDL or the good cholesterol level, being overweight, having impaired glucose tolerance or insulin resistance. So again, we want to look at the liver as part of, look at the big picture and ensure that you're eating a wholesome, healthy diet that is less or minimal in processed foods, less saturated fats, that will enable you to stay active and maintain a healthy body weight.
Another question that we got was from a fatty liver patient, and he said that his doctors had recommended doing a keto diet to eliminate fats from the liver. What's your thought on that?
Well, we ask that question all the time. So now again, I want to mention that there are studies addressing a ketogenic diet and other specific diets, and there are multiple studies that have looked at this and have shown beneficial effects, and some have shown no added benefits. So at the moment, we do not generally recommend a ketogenic diet to help patients with fatty liver disease. So to answer your question, there is no direct evidence yet to say that it benefits patients with fatty liver disease. Again, that's an evolving space, and we'll have more information, probably more data-driven recommendations in the future. But at the moment, we just generally tell our patients to eat a wholesome, healthy diet, as I was just talking about a few moments ago.
And then how is liver disease diagnosed?
You know, one of the things that I want to highlight again is that liver disease is generally silent or asymptomatic. Doesn't have presented symptoms until it's far advanced, right? So some of the common symptoms we hear from patients with liver disease are fatigue, yellow discoloration of their eyes or skin, or jaundice, fluid retention, etc. But keep in mind that these are usually symptoms of patients with more advanced liver disease. So it's worth noting that earlier stages of liver disease generally don't present with symptoms at all. So it's especially important that you take good care of your liver, and your provider, your primary care physician, does the needful to screen for fatty liver disease or look for liver disease when there are risk factors or other things that may point in that direction. So again, there are current guidelines that support screening for fatty liver, for fibrosis related to fatty liver disease in certain high risk groups, such as type 2 diabetics, patients with medically complicated obesity, etc. So it's especially important to protect your liver, take good care of it, get it checked regularly, and we also work with our primary care colleagues and preventive medicine colleagues to ensure that they are doing the needful to diagnose and refer those patients to us at an earlier stage so we can better care for them to optimize their outcomes.
The next question is, can I do liver cleansing?
Again, we ask that question commonly, right? So again, we generally do not recommend liver cleansing or liver detox. So again, there is no objective scientific data to support liver cleansing or liver detox. So again, it's not something we recommend or endorse. And taking care of your liver is just those points I just talked about earlier. So no specific cleansing regimen or detox. In fact, to the contrary, we've had patients who have taken liver cleansing regimens and gone through detox programs that have had the opposite effect and have presented to us with liver injury related to the detox program they were on. So again, not recommended based on current scientific guidelines.
Does drinking a lot of water also help the liver, or is it just good for the kidneys?
Well, again, it's important to stay adequately hydrated. There are specific recommendations related to salt and water intake, especially salt intake in patients with advanced liver disease. But for the general population, there's nothing specific. Just drink to make sure you're adequately hydrated, drink based on thirst, and dehydration is not good for your body in general, but more so for your kidneys than for your liver.
And then what are the success rate of liver transplants, and then can patients have normal lifestyles afterwards?
Liver transplant is a very successful procedure. It's a challenging undertaking, but it is very successful. And I'm proud to report that at Shiva Kumar Abu Dhabi, we are the only liver transplant program that's currently operational in the country. Thus far, we have done 153 liver transplants with success rates that exceed international benchmarks. And we've done liver transplants for both deceased donors and living donors with great outcomes. But to answer your question, yes, the first liver transplant was performed in 1963, and there were many challenges over the decades, but today it's a very successful procedure, and patients, and most of our patients, do very, very well in the long run. And our goal is to ensure that they're able to live their life to a maximum potential without any health-related issues. So again, to summarize, it's a successful procedure which restores quality of life and health to the overwhelming majority of patients who go through them. And again, as I mentioned earlier, we've done 153 transplants, about 30 from living donors and the remainder from deceased donors. And I'd like to thank the other stakeholders who have enabled us to get this far, from first liver transplant February 1, 2018 to thus far having done 153, 16 year to date so far, 57 last year. We wouldn't have done that without our organ donors, the multidisciplinary team here at CCAD, our external stakeholders, the Organ Procurement Organization, the National Transplant Committee, the Department and the Ministry of Health in the UAE. Again, many stakeholders have worked in conjunction to make this happen.
Are there any common symptoms that people can notice to find out if they have liver disease?
Again, as I mentioned, the overwhelming majority of patients who have earlier, milder forms of liver disease don't have any symptoms. So symptoms typically are usually applicable to patients with more advanced liver disease. Now, that doesn't mean you should ignore your symptoms. So again, the commonest symptoms are fatigue, itching, yellow discoloration of your eyes or skin, and water retention, either in your legs or around your abdomen. So many patients do get sent to us because they have routine testing done and they are found to have abnormal liver tests on routine laboratory studies. So that's pretty much one of the most common ways where patients present to us. But again, it's important to keep these symptoms in mind with the recognition that majority of patients with milder, earlier forms of liver disease basically don't have any symptoms.
And what is or are the appropriate investigations for diagnosing NAFLD in adults, young people, and children?
So NAFLD stands for non-alcoholic fatty liver disease, as I mentioned earlier. It can affect the entire spectrum of age cohorts from pediatric to elderly patients. And the evaluation of NAFLD starts with screening for fatty liver disease in patients in the appropriate risk groups, such as patients who have type 2 diabetes mellitus, medically complicated obesity, patients who may have family members with fatty liver related cirrhosis. So those are the groups that should be screened for fatty liver disease. And when they're screened and diagnosed with fatty liver disease, our process starts with doing laboratory studies, minimally invasive techniques such as elastography or fibroscan, which we offer at CCAD, to more advanced modalities such as liver biopsy in a subset of patients who might need that. So our goal in doing these tests is to confirm the disease, find out the stage that it's at, so we can offer you the best possible treatment.
Doctor, could you talk about cirrhosis briefly?
Well, the term cirrhosis refers to scarring in the liver. So I tell my patients, when the entire liver is scarred, shrunken, and not functioning properly, that's what we call cirrhosis in layman's terms, right? So again, the term fibrosis is the liver has remarkable ability to regenerate. So all of these liver diseases, whether it be viral hepatitis, fatty liver disease, or alcohol, they converge to a process of inflammation that ends up with the death of liver cells, overwhelming the ability of the liver to regenerate and eventually getting replaced by fibrosis that builds up over years to decades, typically not weeks or months. Typically it's a longer process to the point where the entire liver is scarred, nodular, shrunken, and that's the stage where we call cirrhosis. Now, even at the early stages of cirrhosis, if you take good care of your liver, in some cases cirrhosis is potentially reversible, especially if we are able to treat the cause of the cirrhosis, such as viral hepatitis, fatty liver, etc. Again, reversal of cirrhosis is again not a universal phenomenon. So we recommend, our overarching goal in treating patients with liver disease is to prevent the development of cirrhosis. And once you develop cirrhosis, you take good care of your liver. We continue to monitor it closely. And in patients who have liver failure and or liver cancer, those are the patients we would consider for liver transplant. And again, as I mentioned earlier, it's a very, very successful procedure that enables us to restore patients back to a very, very healthy, normal life that they had before they got sick with liver disease.
Doctor, are there any supplements such as omega-3s or things that people can take at home, like apple cider vinegar, to sort of prevent fatty liver disease?
Well, that's a good question. We get asked that all the time. So again, are there specific supplements that we would recommend to prevent fatty liver? The answer is no. So how can you prevent fatty liver disease? Number one, by far, is to maintain ideal body weight, and number two is exercise. Again, not in that order particularly, because exercising is as important, but it's maintain body weight, be active, exercise. Now, it's important to point out that even in patients with known fatty liver who have been diagnosed with fatty liver disease, you could reverse it with weight loss. So studies have shown that magic number is about 10%. So if you lose 10% of your body weight, you can effectively reverse fatty liver disease. But the key here is not just to lose that 10%, but to maintain that weight loss and drive yourself gradually towards an optimal body mass index. But again, coming back to the original question, any specific liver supplements we would recommend? The answer is no. However, it's worth noting that omega-3 fatty acids, we do, in patients who have other components of the metabolic syndrome, have high triglycerides, low, good cholesterol, etc., omega-3 fatty acids may be of adjunctive value in that group of patients, but we don't use it to treat fatty liver per se, or to prevent fatty liver per se, but we use it to treat the hyperlipidemia in a group of patients who might potentially benefit.
Can a simple CBC give indication of liver problems, and has the pandemic increased liver issues in people?
Well, first question is CBC. So CBC is a complete blood count. 2 points to remember here. First of all, in the vast majority of patients with earlier stages of liver or milder forms of liver disease, the CBC is entirely normal. It is useful in patients with more advanced liver disease, where the most common thing we observe in CBC is a low platelet count. It's often a red flag when we see blood reports come through. A low platelet count that's persistent is often a pointer towards the presence of more advanced liver fibrosis or even cirrhosis. Coming back to the second question, yes, I think the COVID pandemic has impacted our liver practice in 2 ways. Number one, a lot of patients did not seek care during those 2-3 years of the pandemic where access was somewhat limited. Now, thankfully, we are back to being fully operational, and we are busier now than we've ever been, even before the pandemic. The second point is COVID can affect the liver, as it can affect any part of any organ in the human body, right? The spectrum of liver manifestations of COVID is quite broad, affect the liver cells, bile duct cells, and it has actually been linked to more advanced liver damage as well. However, it's worth noting that the vast majority of patients with COVID infection don't develop liver problems, and the vast majority of them who do develop liver inflammation do recover and resolve with improvement and recovery from COVID. It's a very small subset of patients that do develop more problematic issues stemming from COVID infection of the liver. But again, we are seeing more liver disease patients, presumably because they were reluctant to seek care during those really difficult 1 or 2 years of the early years of the pandemic.
How easy is it to reverse stage 1 and stage 2 NAFLD?
So NAFLD again is non-alcoholic fatty liver disease. When you say stage 1 and stage 2, typically for us staging means is fibrosis. We grade liver fibrosis on a scale from 0 to 4. 0 as being no fibrosis or a healthy liver that may have fat but no fibrosis, and 4 is cirrhosis. It's worth pointing out that liver disease, in fatty liver disease, the sequence of events is as follows. Step 1 is the development of fat, and most patients develop fat in the liver but don't progress further. Step 2 is fat causing inflammation of the liver cells, and step 3 is the inflammation leading to the death of liver cells and fibrosis and subsequent progression. So to answer your question, as I mentioned earlier, earlier stages of fatty liver disease where you have fat, inflammation, and some fibrosis is definitely reversible. Again, a couple of things to keep in mind. First of all, at the moment, we currently don't have any approved treatment options for fatty liver disease from a medication standpoint. That is why exercising, eating healthy, and losing weight and maintaining optimal BMI is especially important, because you could reverse fatty liver disease in its earliest stages by doing all of the above. Again, keep that number in mind. About 10% is where we see the maximum benefit from a weight loss standpoint on liver disease. So again, it's very reversible, and there's a lot of ongoing clinical trials of newer treatment agents in fatty liver disease. Again, I think the day is not too far away when we will see the first approved agent for fatty liver disease. But at the moment, our emphasis is on screening, appropriate diagnostics, and taking care of the whole patient, treating other components of the metabolic syndrome, weight loss, working closely with primary care physicians and endocrinologists. And like I mentioned earlier, there are certain treatment options that are considered off-label that may be used in these patients, especially if they have other features of the metabolic syndrome. So the things that we consider in these patients on a case-by-case basis are certain diabetes agents that may have dual benefits on diabetes and fatty liver disease, omega-3 fatty acids, vitamin E in a subset of patients. So those are the things that we do currently, but the day is not far off. Looking ahead from 24, as we move through the decade, we are expecting to see many new agents that come through that are going to be approved for fatty liver disease. But remember, keep in mind that even if there are approved drugs for fatty liver disease, for the earlier stages of disease, we're not going to be using medications. We're going to be focusing on the patient as a whole and mitigating all components of the metabolic syndrome by focusing on a healthy lifestyle.
So people have heard of the new cancer center. Does that mean that there are more treatment options for liver cancer?
Yes, I'm proud to report that the Cancer Center here is formally operational and offers the entire spectrum of care that any cancer patient would need. Specifically from a liver standpoint, what the Cancer Center enables us to do is it enables us to offer a patient with liver cancer the entire spectrum of treatment options that are applicable, which includes surgery, transplantation, radiation, chemotherapy, immunotherapy, all of the above. And so we have advanced diagnostics that enable us to appropriately diagnose and stage the cancer and then offer them the most appropriate treatment, with the understanding that the liver is unique in the sense that the liver is the only organ in the body where we actually treat cancer by transport. And that's because the majority of patients who develop liver cancer have cirrhosis. So we can actually kill two birds with one. Now, not all patients with liver cancer qualify for a transplant, but I'm proud to report that we have stellar colleagues in the cancer center, in medical oncology, radiation oncology, and all support services that enable us to sit together as a team, meet for our weekly tumor board, so we can offer these patients the best, most, we would like to call it, tailor-made precision medicine approach to treating these individual patients, where we offer them the treatment that is best suited for them to optimize their outcome.
Are there any, I know we spoke about this earlier, but are there any specific benefits of being on a vegetarian diet?
We don't generally recommend a vegetarian diet per se. However, it's worth keeping in mind that less processed food, less saturated fat, perhaps less red meat, etc. is overall good for the liver, as it is for you in general. But again, do we recommend a vegan or a vegetarian diet specifically from liver standpoint? The answer is no. But again, we recommend that as part of a wholesome. Our dietary recommendations are to focus on those things that I mentioned earlier, and also keep in mind that it is not just the diet, but it's a healthy lifestyle as well that helps us maintain good liver health.
We've got a question here. Is it really true that it takes 2 to 3 years to clean your liver from the fat with like healthy lifestyle and everything that we spoke about?
Well, the timeline for regression of fatty liver varies. It all basically depends on it depends on the stage of the fatty liver. Earlier stages depends on how much weight the individual patient has lost, etc., etc. So to answer your question, that timeline is variable from patient to patient, but typically the patient at the earliest stage of fatty liver disease, with or without fibrosis, is potentially reversible. We work very closely with our dietetics colleagues to emphasize the role of diet and healthy lifestyle, and we definitely do see a regression of fatty liver disease. Now, it's worth pointing out that we have a very, very successful metabolic and obesity program, and we work very closely with our obesity medicine specialists, endocrinologists, and our surgical colleagues, because there are a subset of patients who are unable to lose weight on their own, where there may be either medications or surgical options that may enable them to lose weight. Because again, weight loss to the point of maintaining optimal BMI is the best thing you could do to reverse fatty liver disease. That timeline being variable, but it certainly doesn't take 2 to 3 years, and we certainly don't recommend any drastic unscientific approaches to weight loss, but we recommend being evaluated as part of a multidisciplinary team so we can come back to you with the best approach that might work for you.
And we've got another question. Can you explain the child score C and MEL score of 22?
Okay. Well, the child and the MEL scoring systems don't apply to all patients with liver disease. They only apply to patients with cirrhosis and advanced liver disease. So they are prognostic symptoms. And what that means is they enable us to identify the sickest patients, basically identify patients with more advanced stages of liver failure, right? So the child score goes from A to B to C, and the MEL score ranges for practical purposes about 6 to 40. So to answer your question, MEL score of 22, child score of C is a patient with fairly advanced liver disease who should strongly be considered for liver transplantation unless there are reasons not to do so, unless there are contraindications to do so. So that's the scoring system, and again, I'm happy to go through that in more detail if needed, but that's broadly the scoring systems that apply to patients with cirrhosis to judge the degree of liver failure and determine and risk stratify them for transplantation and determine their priority for transplant. But this patient you mentioned with the child score of C and a MEL score of 22 should certainly be evaluated for transplantation, if not already being listed for transplant.
I think we're done here.
Okay, so thank you all for joining us today, and we hope to see you again in a future Instagram session. But again, as I mentioned, we are happy to offer the entire spectrum of care that patients with liver disease would need, potentially from prevention screening to advanced diagnostics and treatment at CCAD. And we look forward to helping our community improve their liver health and take better care of themselves. Again, thank you for joining us, Doctor.